Hi there, Dr. Terri DeNeui again. Going to continue the conversation about thyroid because it really is a pretty big conversation, but I want to just give you a little snippet so you can understand as a patient or as a potential, as a healthcare provider, how you can better help your own patients. So we talked in a previous video about how TSH is not, and there's now new studies coming out, thank goodness, that have stated we should not be looking at TSH as a biomarker for thyroid function. I agree 100% because all it's doing is telling us how much T4 is in circulation. That doesn't tell us anything about the thyroid at the cellular level, right? So TSH, T4, T3 converts to free T3, but one of the things that can also happen with your thyroid is an elevation in thyroid antibodies, and when they get really high, that can really impact thyroid function. Hashimoto's thyroiditis is what we call this when thyroid antibodies are elevated. But what a lot of people don't know is you can actually reverse, certainly prevent Hashimoto's, especially when you catch it early, by changing your diet and addressing your gut health. Because the number one, what we're seeing in studies, cause of Hashimoto's and many other autoimmune disorders like eczema, psoriasis, rheumatoid arthritis, lupus, is leaky gut or impaired gut health, or what we call intestinal permeability. I'm going to talk about that in another video, but understanding that you can help fix this leaky gut and help your thyroid simply by cutting out gluten. I'll talk a little bit more about gluten and its impact on the gut later, but gluten, inflammatory foods, nightshade vegetables, those are all inflammatory to the gut. Bad news for those of us that love spicy food and things like that, but if you can just heal your gut and get rid of some of those inflammatory foods, it can really impact your thyroid function. And I just want to talk to you a little bit too about other things that can impact the conversion to free T3, and some of them are things that you may not even realize. The number one thing that people don't realize, and even many healthcare providers, that can impact the conversion of T4 to free T3 is levothyroxine, which is a synthetic T4. So synthetic T4 has been shown in studies to stop this conversion. The other thing that can impact it is low-calorie diets. I see patients that do very low-calorie diets. It whacks their thyroid. So these 500-calorie diets, HCG diets, it can really impact your thyroid negatively. Stress. Okay, we all know stress can cause bad things, but stress actually can directly stop this conversion, and cortisol plays a huge role in that, and it does that by increasing another hormone called reverse T3. And what reverse T3 does is it picks up this T3 here and turns it back into T4, so you're in this constant loop and your body never gets enough T3. Stress causes that via cortisol, increases reverse T3. So hopefully this helps further a little bit of the conversation about thyroid, but understand thyroid is a big conversation. It's not just about looking at one lab, it's a big conversation with a lot of variables. And if you want more information, please visit our website and visit one of our providers.